to be in a facility that I have multiple doctors, we have acupuncturists, we have chiropractors, and by being introduced to the similar research, we're coming together more and more and more. So for example, going back to that patient that kept coming to me every 3 months for cleaning, I have an MD next to me that also understands this relationship.
Okay.
And by forwarding or just guiding our patients, giving them the option, you might, when was the last time you saw your doctor? You had a blood test, you had a hormone test. 3-4 years ago, I can't remember.
Yeah.
It's
Excellent.
all about preventive medicine.
Give us some examples, Dr. Panah, of how our teeth are tied into certain organs and that whole scenario there.
If you look at any anatomy book, our vascular system, lymphatic system, neural system, it's one big mesh of interconnected arteries, veins. So the tooth, your tooth is actually connected, is a part of your body.
Okay.
So that's one way of looking at it. So if I have an infection that's going on here, for example, infected root canal, gum issue, that infection, that bacteria is circulating throughout the whole system. So your liver, kidney, the rest of the organs are also dealing with this bacteria.
I think for so many people just think it stays right there,
Well, it's interesting enough, if you look at some of the, well, I'm sure we can get into this later, but some of the patent laws of some of the dental materials that are out there, for example, silver fillings, they have classified it as a substance that is used outside of the body. So, the new era is systemic dentistry. Your teeth are actually connected to the rest of your body.
Exactly. Wow, interesting. So, when you say then that a problem in your teeth, it can affect your organs, and it's just mostly then the by reason of the bacteria.
Is via bloodstream, venous, neural system, lymphatic system.
Oddly enough, I have a friend that just a while back ended up with a couple abscesses in her teeth and waited to get help. Make a long story short, the nurse told her, you could have died.
Absolutely. This is at any time, our mouth, we have over 1,000 different types of bacteria. These bacteria go back to dinosaur era. These bacteria know how to survive, know how to defend themselves. Quite a number of them are anaerobic bacteria that doesn't need to live on oxygen.
That's interesting.
They know how to defend themselves. When you're given antibiotics, well, they don't die, they change in shape, form. They become mutant to that antibiotics.
Sounds like a movie.
If these bacteria were lifelike, they would take over the world within seconds. Well, in a way, I think they have already. But our jaws, our mouth are at a medium for harboring all this bacteria.
So, at the minimal, what do you recommend to the viewers as far as dental checkups and things like that?
Make sure, well, I get that question all the time. A question that I always tell my patients that call me from all over the world, all over the States. How do I know? Ask your dentist. What's the last course you took?
So put it back on them.
Yeah. Can I see your CV? What are your thoughts and ideas about dentistry? Do you believe that nutrition and dentistry go hand in hand together? I mean, nutrition is a part of one's well-being, sort of that type of thing. So it's all about research. One dentist might be very happy with the type of life they're living by drilling, filling, billing. Another one might constantly be in school to learn and advance and be able to help their patients more and more and more. One thing I couldn't understand was, as a student, how come you come and you get a little filling becomes a bigger filling becomes a crown becomes a root canal becomes extracted, becomes a bridge, and then you have a denture. That can't be. But everybody that I know is going through this vicious cycle. And I knew that was not the right approach.
Yeah, that's interesting. I'll tell you. I haven't heard a dentist put it quite that way. So at the minimum, though, you're recommending people get in at least their regular checkups and begin to inquire.
Absolutely.
And
Absolutely.
how does the age factor in?
Well, when you're going through puberty, that's when body needs minerals. That's when body needs for the neurotransmitter hormones to be available and working properly. That's the time a child needs nourishment, exercise. If you see that during these time there's an acne issue, you go to the dentist, there's a large number of decay. Of course, you always want to make sure that your patient is brushing, flossing properly.
Sure.
It's like taking a shower. You want to cleanse the area, keep the area clean. But when the body is looking for the next source of mineral, when the body is acidic because of a lack of minerals or some sort of a bacterial, viral, fungal issue, the body kind of compensates by going after your teeth or your bone. Tooth decay is just another word from osteoporosis, basically. So you want to make sure that individual, take it to the doctor, make sure your son or yourself, the blood levels are good, the nutrition is good, little things like that. Again, preventive.
Well, I'm sure people are going to get a hold of you because this is very interesting. It's a whole nother look. We're going to cut to a commercial, but when we come back, we're going to shift a little bit and talk about children and the mercury fillings that we introduced in the show. So we're going to cut to that commercial right now.
Real men know that getting tested is the way to take care of their families. That's why real men wear gowns. For a list of the tests you need, go to ahrq.gov.
Well, that's a topic for another day, but back to Dr. Panah. We're going to focus in now. It's so important. Children's dental health and the whole issue of mercury fillings. And I think mercury fillings kind of were so the norm back when I was a child. And the progress, or maybe the progress is not the right word, but the development of the perspective nowadays. Talk to us about that, doctor.
Let's step back, look at the history of this a little bit. Again, if you go back to late 1800s, if a dentist used mercury fillings, they would have their license taken away. Some way, somehow, we started using again, all over the world basically. But more and more our brothers and sisters abroad, Germany, Sweden, Switzerland, recently just Poland, they have banned mercury fillings due to multiple reasons, environmental or for health reasons. The research that's been introduced to us, it's overwhelming. There's a lot of research right now that claims, for example, that when a mother has silver fillings, those silver fillings, that toxicity that's released from these silver fillings is able to affect the fetus.
Now, okay, I'm thinking here, you get, a lot of times you get these as children.
Well,
you're in your mouth the whole time.
When I'm going back when your mom is pregnant with you.
But they're still active, that mercury's still active in all those years.
It's the research, the scientific research shows that these fillings constantly are evaporating mercury.
Okay.
I'm not even sure. I'm sure that you might be familiar with Proposition 65 in California, that basically states that silver fillings, a lot of materials used in dentistry, can cause reproductive harm or cancer